Take your medication, exercise, and diet. On 88.5 Soufriere FM. Tell a friend, call your neighbor. Casualty 911 is on.
Good morning and welcome to a new edition of Casualty 911 this lovely Monday morning. To all of our regular listeners, it is a pleasure to have you on the program as usual. Those of you in the various business places, the bus drivers, those of you joining us for the first time, a hearty welcome to you this morning. Today we have a lovely guest with us. We will be discussing oral health. Can you hear me, miss? And just
Yes, I
checking.
can. Yes, I can. Oh, loud and clear.
Wonderful. So today we will be talking about World Oral Health Day, and joining us to discuss the topic is Miss Cherryl St Cyr, who is a dental hygienist. And before we delve into the topic, I would love for you, Miss St Cyr, to tell us a little bit about your experience as a dental hygienist. And for those of our listeners who may not be familiar with the term, to tell us what a dental hygienist actually does.
Okay. Dental hygienist is actually where we're responsible for the structures around the tooth, which is actually the gums. So we deal with gum disease mainly. We do with oral hygiene in terms of instructing, hoping to change lifestyles, and we tackle all of what that would it entails in terms of diseases that would come about if there is poor oral hygiene, especially with the gums actually. Okay, the dentist would more deal with the tooth structure, the tooth itself, but we would do with we deal with the surrounding structures.
Wonderful. So can you tell us a little bit about how you got into that profession and how long you have been in that profession?
I've been in the dental profession for so many years, I cannot even tell you from when I started. I, I actually, what I would say is that I was at school in Form 2. Some dental hygienists came in and did oral health education, and I said, I want to do that. That's how it started. I said I wanted to do that. I was in Form 2. That's a long time ago. I don't even go into how old I am. And then I didn't really work towards it, but it just came about that my first job that I worked in a private practice. My first job was in doing dental assisting, and I did that for more than 20 years before I was able to go to school to do dental hygiene. And now I'm a dental hygienist, which is what I love doing.
Well, you have that sort of enthusiasm that says you love your job.
Yes, I do.
So I'm sure you will be very happy to discuss with us this morning all about oral hygiene
Yeah.
as we discuss World Oral Health Day, which is actually on Thursday, not today, but on Thursday. And there's a theme, which I will
Right.
allow you to tell us what the theme is. And then we will speak a little bit about the theme. We will also touch on other issues related to the teeth. So, in terms of, the impact of certain lifestyles on our teeth, we will talk about the quality of life. I guess all of that is related to the theme. So you go ahead and tell us what
Yes.
the theme is, and
Mm.
then we will get into our little discussion.
Okay, Ms. Minvielle, I must say thank you for affording the dental leave services unit for giving us the privilege of being able to be here with you and to be with the nation as well, by extension, to be able to explain or to promote World Oral Health Day. Hope that you're still hearing me. Okay, I'm still on board. Okay, should I continue? I'm not hearing anything at this present time.
Last five on diabetes,
Okay, thank you so much. I was not hearing myself, but
AIDS, pregnancy, sex,
Sex? Did you say sex?
as prescribed. Take your medication, exercise, and diet. On 88.5 Soufriere FM, tell a friend, call your neighbor. Casualty 911 is on.
Good morning again. So we had a little bit of an issue. Sorry about that. So we
Yeah.
will rewind. We will rewind. And I'm not sure if you had already said the theme, but we will say it again. You will tell us.
It
You
was
will,
just as I was about to speak, actually.
okay.
All
So
right.
let's take it from there.
All right. Thank you very much again. Yet again, I will say thank you. Our theme for this year is a happy mouth is a happy mind. And this theme, it focuses on the intricate link between oral health and mental health. And let me just hasten to say nothing can light up a room when somebody walks in. Imagine without turning on the light, somebody can walk in a room confidently and just smile, and that lights up the room, and that tells you about a person's well-being. So we this year we want to empower everyone to value and to take care of their mouths, and to understand by doing this they can also protect their overall well-being. And when I look at it as well, just like layman terms, whatever that destroys the body normally starts getting into the mouth. And so is what you put in there, the intake of what you put in there is what kind of all our NCDs and everything is involved. So the mouth is the an orifice that is just so, people look at it as sometimes it's nothing, it's just there for you to smile, but it's so much more than that. It is so much more than that, because the various stages of our life we would need our teeth. Life begins in the mouth, actually. When cells come together to make the body, it begins in the mouth. And so, as not only that, as well as um without eating, the primary function of the teeth, or whatever that's in the mouth, which is the teeth, is to eat. And if we don't eat, we will starve to death. So you understand what I'm saying? And there's so much. Our teeth also helps us in speaking properly, in formulating our letters. Not only the smile that gives us the confidence, but it gives us a lovely appearance as well. I see that we have down again.
Neighbor. Casualty 911 is on.
Having some issues this morning, unfortunately. And imagine, I remember when we were discussing, you
Yes,
were mentioning that you would have
I
had
was so
issues on,
concerned about it.
you were concerned about issues on your end, but this morning we're having some technical difficulties on our end,
Okay.
unfortunately. So sorry to have cut you short yet again. So we will go back and you were speaking about the importance of the teeth and the mouth.
Right. So I'll continue. As I said, it helps us to speak properly. The teeth, when you smile, they're not only just a lovely appearance, but people receive you better when you're smiling. Simple fact. Also, it makes you look younger longer. When you have your teeth in your mouth in the arch that's up and down, it keeps your face nice, round, and supple. You have that nice oval shape to your face. You have less wrinkles as well. So I like to say it makes you look younger, longer. And specifically, and most importantly, we need our teeth first with our food. And if you say, I'm going to mash it and swallow it. That's not what it is for. Your teeth is there to masticate, to chew your food into small particles so that the stomach can receive it. So mashing it up in a plate or in something and swallowing it and say, I'm doing the work of the teeth. I don't need my teeth. That's not what it is. You end up with stomach problems because the stomach is not ready for that food, because the chewing of the food tells the stomach food is coming. So prepare yourself for it. The enzymes are released so that it can break it down. That is it's just so much. It's just so much. The intricacies of having a good oral hygiene is just so much. And I love it so much anyway. Now
You
also,
mentioned so many things about the teeth, the chewing, the smiling, and all of that. And it really says, it speaks to the theme actually. A happy mouth is a happy mind.
mhm,
Because, very often when our teeth are not in the best order, or we're missing a few teeth, particularly the front teeth, or if the teeth are crooked or discolored and all of that, it can impact how we feel about
with
ourselves
ourselves. That
and
is so
how
correct.
we our level of confidence,
Yes,
our self-esteem, how we interact with others, and sometimes we don't even want to interact with
that's
others
right.
if
That's
our
right.
oral eye hygiene is not the best.
Mhm. So it affects our social. You realize that Miss Minville, you know the thing already. It seems you know the thing already. You see, it impacts our social, the social aspects of our life. Imagine I can just, it's not a joke, but I can just say that our opportunities for getting a husband or wife can be affected because of our teeth. Yes. Yes, it is true. Because some people, they would end up with having halitosis, which is chronic bad breath. Some people would end up with, according to you, missing teeth, or you find that they have these stains on their teeth, or they have this decay in their mouth. And when they laugh, sometimes you cannot even laugh out loud, like how Miss Minville laughed a while ago. The laugh is, you have to cover your mouth. You have to cover, you don't want people to see what's inside or what's just in the front. So it affects the social aspect of our life, and emotionally, our children going to school, and then sometimes they have what we call early childhood decay, where every single tooth in their mouth has been destroyed, or there's the destruction of the enamel, simply because of nocturnal feedings. When I say nocturnal feeding, meaning that when they were in the infant stages, when their teeth were growing out, parents were feeding them in the night and not rinsing, not cleaning out the mouth, because you may clean the baby or the toddler or the young child's teeth during the day. But when the child gets up at 2 o'clock in the morning or 1 o'clock in the night, and you give the child a little bit of breast, they take the little bit of breast and they fall asleep. They fall asleep with that food in their mouth. Or you give them a bottle, because both the milk is, all of that is just food from the mother. That is food. So even the breast milk can cause the decay. And these children, by the time they turn 5, because when they are 2 years old, they have all of the baby teeth in the dentition. So then they go to preschool, and in the preschool, you find these children have these little black pieces of stub in their mouth. When they don't know much, they laugh like everybody else. And people say, hey, look at that, And then they grow up with that stigma. They go to primary school because the teeth are not going to fall out. They will only fall out if they take them to the dentist to have it removed because it's hurting. And so they're 5, and when they're 6, 7 years old, the bottom one's beginning to shake, and then it can come out. And then they have to wait for when they're 7, a little older than 7, when the top front teeth, you can remove it, and then the permanent one comes out. But the back teeth are still there because there are back teeth in the mouth that are supposed to remain there until they age 12. So there's a dynamic thing going on. Teeth are not just static and stays one place. It's dynamic. It's exciting, actually. And so you find that that alone can break down a child's self-esteem for life. The child continues to be not just a shy introvert person, but a person who doesn't think well of themselves. It's okay to be shy and it's okay to be an introvert, but you don't feel well of yourself. You don't feel confident in yourself that you're worth it. So you kind of pack yourself in a corner, which we don't want, because that is where we have a happy mouth, is a happy mind. Okay. And we know that sometimes oral health problems, people don't think of it as something so significant, because as far as they're concerned, that's not life threatening. Okay. But it has been proven to be a significant public health issue because of the prevalence. They have so many people with oral health issues. Nearly everybody. Okay. You barely get somebody with no decay, or a child with no decay, or a child that does not need a cleaning. at any one point in time. So it affects the self-esteem, the self-confidence, it affects the social life. It affects the school program because the child will miss school. It will affect the adult, the work productivity because you will miss work. And not one day work, because sometimes when you have an abscess, you home with a fat face for 5 days, 7 days, or you have to wait for the prescription that was given to you, the antibiotics, to start bringing that down for you and for it to look like a normal person again. And you will miss days from work as a result of that. All what I've spoken there, it will affect the quality of life. If it affects the quality of life of a person, it affects the person's mind. No matter how you look at it, a happy mouth is indeed a happy mind.
I want us to go back. That's a very you raised so many interesting points. So I want to go back a little in terms of the choices that we make, the lifestyle choices that we make. You spoke about the babies and the night feedings, and I think many of us never think about, the impact on children's teeth. What could happen? Because basically, at that point, the child probably has zero teeth or just a few teeth, and you figure it's no big deal. So,
Right.
so the fact that you're saying, and that is something that is so common. I mean, you feed the baby falls asleep, and you're happy, you're
Yeah,
ecstatic
you
because
fall
you
asleep too.
rest as well.
Hear what you have. Farmer from the food and stop the people them from starve. Yo, Jaido cities rather than with his stuff. Hard work and me know them must.
So we're back.
Yes, we're going ahead. That's all right. That's all right. We're going ahead.
I seem to be interrupting you a lot.
That's all right. That's all right.
However, we're going to try to make it through because you have a lot of interesting information to share. So I was talking about the fact that it's so common to, just feed the child and go back to sleep. We don't think that it would have any impact on the teeth because there are not many teeth that have popped out yet.
Yes.
And as
Hmm.
you said, the children, the teeth start to grow. But there's something I want you to explain to us as parents, especially of babies and toddlers. Is it necessary to take them to a dentist to get a cleaning?
Okay. Let me just backtrack just a little bit here. When you bring a baby home, the child is fed on demand. There are no teeth. When the child is about 6 months, 9 months, sometimes you see the little teeth start to come out. That means you should not be feeding on demand anymore. So no child should be coming to you, and you're supposed to have your child on a structure, a time for feeding by that time. So at nights, your baby is supposed to sleep at nights. So if you give your baby some water when the child gets up crying, after a few days of getting water, that child will go back to sleep, and when the habit would have been broken, that child will go back to sleep, because when I wake up, I getting water, and I'm not getting the comfort and the soft breast. I'm not getting the hug. I'm not getting that. I just sleeping throughout the night. Most of the time, you can break that habit of feeding nighttime, because you're starting a habit that you just don't want to continue, because the child will have more teeth, and more teeth means more destruction. So you'll find that this is what, as parents, we should not be afraid to feed our baby some water, because the water does not create any destruction on the child's teeth. Now, let me also hasten to say that there's bacteria in the mouth. When the bacteria feed on the food that is left in the mouth, an acid or chemical reaction happens, and that chemical that obtains is an acid. An acid, as you know, I'll just say simply, it burns. It makes little holes. If you put it on your skin, that's what's going to happen. The same thing it does on the enamel of our teeth. So you start having these tiny little pits on your teeth, and the decay process begins. So nighttime feeding is not the best thing for your child, especially when the child start having teeth. Okay. I apologize to the listeners this time. We're sorry, but listeners, we are going right on with it. That's not a problem, right, listeners? We cannot do everything, so what we can do, we're doing. Okay, so I'm going to continue. Nighttime feedings not for your children. You do not want to start that habit of your child eating all of the time. You do not want that. You want your child as a baby to have a structure, when to sleep, when to feed, when to play, when to work. You want them to have a structure. You have a more balanced child when that happens. So start putting your children in a structure of habits that are good. Okay? That's what I need to tell them as the first thing. Now, even when the child has noticed, when there's food in the mouth, there's going to be bacteria. You find that you can get other infections even without teeth. You can have infection in the mouth even without teeth. The dry mouth that happens, and all of the other things that happens as well. So we have to be mindful. Keeping our child's mouth clean is paramount. It's important that we keep the children's mouth clean. So feeding them all during the day. And let me also say, when our children start to run around, when the children running around, they're not hungry. You check your child eyes, you check the skin. The skin is bright, the eyes are bright, the skin is smooth and shiny. The child is happy. So all that feedings we want to give our children as if we're afraid that they're going to starve. Sometimes it's not absolutely necessary. A child can have breakfast, lunch, and dinner. A child can have that alone for a day. If a child is playing, the child is happy. That's why they come back home with the lunch bag load. The same way you put 2 yogurts, 2 packets of biscuit, and the child come back with everything. Happy. A happy child running around has a happy mind, not even worrying about food. And the child is not dehydrated. The child is not malnourished.
Very, very unfortunate this morning.
Yeah. Mhm.
I really don't know what's going on, what's happening.
Well, listeners, we apologize. We're working together, Miss Minvielle and myself, and we apologize for the interruption, but we are going ahead. I hope you're enjoying yourself. Okay? And if you have any questions, you ask Miss Minvielle so Miss Minvielle can relay these questions to me. Okay? So we were talking about how we overfeed our children, and we have the presence of food always in the mouth, which causes the destruction of the enamel. I have already told you what the decay process is. Bacteria in the mouth, the bacteria feeds on the food that is left there, and a chemical reaction happens. The acid is formed, and the acid begins the decay process. All it needs is 20 minutes of you not cleaning out the mouth, and the decay process happens. Just 20 minutes. So if you now start to teach your child, or even you as an adult, after you've eaten something, if you don't have your toothbrush, especially at lunchtime, you rinse your mouth out until you cannot taste what you last ate. It's going to help. Not marginally, it's going to help a lot, a lot in keeping your teeth from having to get decay. Okay? So,
Wonderful tip.
and we need to tell our children the same thing as well. All sorts of things are happening. We need to tell our children the same. Just excuse me 1 minute, sir. You could just turn off my camera, please.
That's fine. So you go ahead and do that, and I will continue. So Miss NC has spoken quite a bit about what affects the teeth in childhood. So there are a lot of things. So number one, she spoke about the structure, and I think it is something that may not be very common in our culture, because I've seen it and I know it to be quite common that children who continue to breastfeed past a year and so on, they feed on demand. The children who can speak, they walk up to their mother and say, I want my breast milk and whatever it is. So that says that it is a habit that was formed very early on and continues into toddlerhood. But that tip that she gave about rinsing out the mouth, I think it's a wonderful tip, because usually what happens is that you're out, you're at work, you're at school, and you may not have a toothbrush to brush your teeth. So rinsing out and getting the taste of the food out of your mouth. That's a wonderful tip, and I think that is something that all of us can can take up immediately. We don't need
Yes.
anything special. We just need some water. You don't
Mhm.
even need water in your tap. If you have your bottle of water, you can use that to do your rinsing out. So that is wonderful. So you
That
go
is
ahead
correct.
now, Miss
Yes. We
Nancy.
actually started that implementation of water rinsing in the preschools last year. We had done it a number of years ago, but last year we did that, in a how will I say, we entered 127 preschools, and we went to all of them and we preached that message to our teachers and administrators, and we also trained them as well as to how to guide parents in what to put in the lunch bag, how they should not load the lunch bag with all of this junk food. And we also had a meeting with the parents as well. Those that were able to come, we met them on Zoom, and we talked about the water rinsing as something that we wanted implemented for our preschool children. We continue to do that. We cannot stop because this year, as for our World Oral Health Day and continuing with our activities, we are going to go into the preschools. We are going to go to the primary schools as well and continue with our message of good oral hygiene.
So since you're on that topic, can you just share with us some of the activities planned for World Oral Health Day?
Let me tell you, it's a blitz. We call it a blitz because it's a big thing. Let me tell you, we are going into the VJ primary school, and every aspect of health is linked with each other. So we have UHC at that school with us on that day. On Thursday, we have UHC with us going to educate our children on the universal health coverage packages, because we want to tell our children everything. We want our children to know everything, and we would hope that when when it is recorded, it can be relayed, and our nation would get the message as well. We have nutrition. Nutrition is going to be there with us, teaching our children, teaching the children at that school at that time about the healthy foods. We hope that some parents would also attend that day because it's a whole day. And then we have Bureau of Health Education. You, Miss Minvielle, I know that you'll be there with us. Yes,
My
yes.
colleague will
Yeah,
be with you.
that's right. So we'll be expecting some talks on self-esteem, on self-confidence, empowering our children, making them see the relationship between good oral hygiene and having a happy mind. So we would expect that. And we have the mental health nurse there with us as well. And then she will tell us about the general well-being, what it is to feel well. We want to educate our children. We have a medical team is going to be there with us. They'll be taking the vitals. They'll be doing um, health checks as well. They'll be providing emergency care if the need arises. They'll be taking the oxygen saturation, temperature, respiration, height, and weight, so we can let our children learn what it is like, so that people don't like to go to the doctor. They don't like to go to the doctor.
Some people, some
Yes, some people
people,
don't like to do the doctor. And so we want our little children to know when you go to the doctor what happens, what it does for you. It gives you an earlier clock notice of what is going on with you. So on that day, we have all of these people with us in the school. giving the children what they need, the education that they need, sharing with them, as well as we have the dental team. Of course, we're going to be there, and we're going to be there in a big way because we have these mobility units with chairs and lights and everything, just like a mini, large clinic we're going to set up in one of the rooms. We'll be doing cleanings for the children. We'll be doing feelings for the
Those of you who may not be aware of where the Vigie Combined School is, I'm sure Miss Sensi will tell us where that school is.
It is in Deriso, actually. It's in a small community, and the children of the community, well, they've never had something of that nature because it's a little bit in the interior. So we've chosen that school as, yes, it's a small school, yes, it's a small community, but it's in the interior, and we want everybody to know what is going on. Okay, so it's a small school with 55 children, actually. That's the school. And we hope that after we finish, because I didn't finish saying what we're doing cleaning, fillings, and extraction for all of these children. We may not be able to do all 55 children because we want everybody to get a cleaning. But if you come for a cleaning, you may not want to do the next step, which is a filling or a cleaning. So we will come back again. We'll have yet another day to come back to the school to finish up with these children, because we want that school to be the light. We want that school there, an example, because at the school, the teacher tells us that there's no junk food being sold at the school. She doesn't have these types of things at her school, which is a good thing. When we have so many schools who sell soft drinks, who sell the things that are not good, and Miss Minvielle, you can appreciate that, right? That that has no nutritional value to our children, and this is what the children are being fed. So I don't want to go down the nutrition path or the Bureau of Health Education path, but I'm just saying that there
Oh, it's
no nutritional value whatsoever.
as long as you work in the field of health, we have a responsibility. And since you mentioned that they don't have that being sold at the school, then it really speaks to the parents' responsibility now on what they pack in the
The
lunch.
bags, that is correct.
There is an exercise that the nutrition officers and the nutritionists do that I find so very interesting, and I hope that they will be doing it on that day, which is to show the amount of sugar
Right.
of popular drinks, some of the soft drinks and the boxed juices and so on, to really give the children and the parents, because adults as well may be unaware of the amount of sugar. And I think if there's one thing that we all learn from very young is that sugar is bad for the teeth, right?
Right, right,
And one
right.
thing that we hear over and over again is that sugar is bad for the teeth.
And another thing, the nutrition department has a tagline, top sick pa bon. They have that,
Like,
and they have a song singing top sick pa bon, and we need to learn that. We need to learn that. This is so serious. You need to learn that. Yes. But then we hope that Thursday is going to be one nice sunshiny day, physically sunshine day I'm talking about, and we're adding some sunshine into the lives of these children that are there. And I know that the parents are going to be happy. So we know that it's going to be a happy day. So we come back to our theme: a happy mouth is a happy mind, and we're spreading happiness on Thursday. I cannot wait for Thursday. I cannot wait for
tell
Thursday.
that you're very enthusiastic and looking forward to it.
Yes.
I'm sure that the children, once those who have those little fears and concerns, once they have had their teeth cleaned and things taken care of, they will have a wonderful day as
Time. Yeah,
So
like the dental team also will be doing oral health education like one-on-one because they have enough of us there. The school is small. So we're taking the children and we're trying to mold and to change lifestyles. So they're going to be the aftercare, the before care, the during the care. We're doing everything. It's a blitz. That's what we call it, a blitz. So you know everything out there in a big way.
that sounds wonderful.
Mm.
So as you said, the habits have to start very early. So you targeting this year a small group of children. Now there's some issues that you raised earlier, and I would like to go back to. Since we've spoken a lot about children, I also want to speak about not just infancy and toddler and early primary, but what happens in adolescence and as people become adults? You joked about the husband getting the husband or the wife, but we also have to consider getting the job and keeping the job.
That is correct.
How our oral health can affect our productivity, our
At work.
employment prospects, particularly as it relates to halitosis. And I want you to speak a little bit about that. Tell us, explain to us whether there are lifestyle choices or lifestyle habits that can contribute to it and how we can reduce the risk of,
Okay.
because that can create a whole lot of
That's
anxiety.
all. Oh, yes, it can. And some people are not even aware that they have it because it has become that's what I am, that's who I am. So they're not aware that it is offensive as well. Now, the halitosis, the smell sometimes can come from the stomach, the back of the throat, but we're dealing with the oral cavity. It simply means that you need to go and get a cleaning. You need to go and get a cleaning done so that they can remove what's causing that smell. And it is usually bacteria, small particles of food. Take for example, a child comes home with the lunch bag. You know, by the when you use the lunch bag all week, so there must be some spillage in the bag. And if the bag is not wiped or clean the Friday, the Saturday, or the Sunday, and Monday morning you come for that bag, what a smell in that bag, a sour smell in that bag because the food particles have, and just sometimes just a little bit of sauce that fall in the bag and not anything significant. And you see the few days that it stays there, what happens? The same thing too in the mouth. Tiny particles of food that we can see for our naked eye. Plaque is a sticky substance, and the food, the fine particles adheres to the plaque. The bacteria in our mouth feeds on it. There's a mix going on there, chemical reaction going on there. Food particles remaining in between the teeth because it's stuck to the plaque. Because plaque is like a glue, and it's there 1 day, 2 days, 3 days, 4 days, months. It's there, obviously. And there's a lot of space in between the teeth and around the teeth. Actually, there's a 3 millimeter depth around the tooth, inside, outside, and in between. So food particles can get wedged inside of there. And obviously, just like the lunch bag, just a weekend, the lunch bag stays there. And if we have it there 1 day, 2 days, 3 days, weeks, we are going to get that odor. So sometimes it just means that you need to go in for a cleaning and you need to be taught how to clean the teeth. You need to be taught that you need to floss in between your teeth because that's how you can get to clean in between the teeth. You don't floss because a piece of thing got stuck there. A piece of meat, when you eat saltfish like to get in between your teeth. You're not going to go and floss only when you eat saltfish. You have to floss every day, once a day, every day because the particles are so small you cannot really see it with your naked eye. So you just have to do it. Just have to do it. That's all. And so cleaning the teeth, you doing the home care and doing it properly is going to help. You going to your dentist at least once every year, twice a year is ideal. It's going to help you because while you're doing it for months, you're going to miss little areas. And when you miss little areas, food start to accumulate there. And you can have halitosis in certain areas are localized, or you can have it generalized all around. Now, sometimes the halitosis also alerts us that there's a tooth with a cavity. Sometimes people do not even know that, hey, I have a hole in my tooth. I didn't even know that. You understand? So it also alerts them that there's a cavity and there's that smell of something rotting in the mouth. And you need to go to the dentist to go and take care of that tooth, however way it's best for you. a filling, an extraction, a root canal treatment, but something to take care of that too, that is just open there with that food particles down inside of there and that rotting smell inside of there. So that's what we need. And unfortunately, as I said, some people are not aware. Some people mask the smell with a mint sweet, compounding the problem by introducing more sugar in the mouth. Because the mint sweet is usually a candy. It has a little mint flavor, yes, and it's not lasting anyway. So you use it all during the day, and the older people used to say, "I sucking a mint, eating a mint." You know them already, not mint, a mint. And that in itself, we have to break that habit. I have noticed also because my son went to my children, when both of them went to for Louis. Whenever they had to buy food, the few times they've had to buy food, he would come home with the red and white sweet because that's the new fashionable thing. When you buy lunch, they give you a red and white sweet, that little candy, the little mint. So you eat, instead of going and rinse your mouth out to remove the food particles, you suck on the mint and you just go about your day. And you brush your teeth sometimes late into the night. Obviously, the decay process would have begun. Obviously, acid would have formed and little pits are starting to form on your teeth. You understand? And all you needed to do to keep your mouth fresh, for you not to feel, not to taste the fish that you ate. You say, I am breath smelling of fish. Just rinse your mouth out with water and rinse it out until you cannot taste what you last ate, and you'll be fine. Now there's the chewing gum that is also good, but the sugarless gum or the gums that are sweetened with a sweetener called xylitol, it's good. Because the chewing gum, remember what type of chewing gum I said, eh? Okay, so I didn't say go and buy any type of chewing gum, eh? All right. So the chewing gum now, it promotes the secretion of saliva. And the saliva comes in with all these little medicine, calcium, magnesium, and stuff like that to help to remineralize teeth that have been getting the little pits as well. It also washes away, it makes you swallow. So it makes the saliva, it washes on the teeth, and it makes you swallow as well. Okay, so that is a good thing. But the best thing to do is to rinse your mouth out with water and make them mouth fresh again. And sometimes we have people with this tongue that is so coated, they do not brush their tongue at all. The tongue is like a mat. You see, when you wipe your feet on the mat, you take off the mud underneath your feet. The tongue is like a mat. It pulls all the particles of food. Sometimes we have our children. I brush in the teeth every day. You hear the parents say, I don't know why I always taking this odor in her mouth. Is it her throat? Is it his throat? You know? And sometimes it's because the tongue is matted. It is thick, it has this thick white coating on it. And if you just ask the child to stick the tongue out, stick it out, you wet the toothbrush, or if you have the tongue scraper, if you don't have the tongue scraper, the toothbrush works. You stick your tongue out, wet the toothbrush, and you sometimes you have the tendency to gag. You just have them to make a sound. It will fool the brain into not knowing what's going on. So you brush the tongue and you just make a sound. And it can be so funny, but it helps. You put your tongue out and then you scrape it, you brush it out, you multiple times, wetting it until you can get this thick coating of the tongue. You don't want that coating there in the first place. So every day you must brush the tongue. If you have a child or if you hasn't grown up that gags easily, you make a sound while you're brushing your tongue. Okay? You look in the mirror and you do it. Check your teeth out. If you can put the eyeliner and take that time and do that meticulously, that's a lot to not to let that brush get into your eye when you're doing the eyeliner. Take that toothbrush and open your mouth and look at yourself in the mirror while you're doing it. You find you'll take more time in doing it. You find that you will not miss areas as well. And you'll say, I'm not going from there to there. I'm going from there, going right around. I'm having a system. I'm going to use a system to brush my teeth. I start on one end. If it's the left, I start on the left and I go right across to the right hand side. Then I go inside. I go on the chewing surfaces. I do the back of my teeth. I do the same thing for the top. When we do that and then we floss, we're doing well. And just add a visit to the dentist at least once a year. And you right on top.
So these are wonderful tips. There's another question I would like to ask in terms of older adulthood. So we
Mhm.
spoke about children and young adulthood and adulthood. Is it just um absolutely going to happen that when we get to an older age we will lose all of our teeth? Or are there practices that can help individuals to keep their teeth for a much longer period of time?
Yes, yes, there is. And it is taking care of it throughout your life course, eh? And when you get to adult or the elderly area, the senior time of your life, you find you have that habit already, which is to brush, which is to floss, which is to visit your dentist. You find that we associate gum disease with the older people. We have children with gum disease. They have the mild form, the more advanced form. They have the periodontitis, where the structure of the tooth that is held by the bone is attacked by the bacteria and it absorbs the bone. And you find in our elderly people having teeth that are shaking. Shouldn't
Yeah.
have teeth that are shaking. It is because of the gum disease that is causing that it start attacking the bone, which is the structure that holds onto the tooth and keeps the tooth steady. When it attacks the bone, it destroys it, it absorbs it, and there's not much more bone to be held by the tooth. And so the tooth begins to rock and shake, and they have to lose the tooth. But it all takes, and even when the teeth are already rocking, when they come for a cleaning and they change the habit, they can extend the life of that tooth. So it doesn't always mean that. Actually, you find the 20th of March for World Oral Health, they've been celebrated March, which is the third month of the year, and the 20th, 20 meaning a child has 20 teeth. And it's expected that a senior person to end up with 20 natural teeth, at least 20. We want more, at least, what I'm saying, but we want at least 20 natural teeth for them. And the March 20th is normally written as 3/20. So we get the 3 and the 2 from the 20 as 32 teeth in the adult's life. So you know what I'm saying? See how dental is so intricate? Oh, even the date that we have chosen is just there, right?
So significant and
So,
it's
so
so.
sick. Oh, yes, that's right. Yes, yes, the dental life is a wonderful life.
So that is very, very interesting. We speak a lot about what we eat in terms of our oral health, but there are other lifestyle practices that I suppose would have a significant impact that can really affect the look of our teeth and the health of our teeth. And
Mm,
that would also impact how we feel about our smile, our ability to smile, our ability to eat, our ability to socialize. And one of them is the use of tobacco. How how does it really affect the teeth, and how could it impact the person who uses tobacco mentally?
yeah. Okay. We will leave the odor still, eh? But the yes, yes, yes. The ashtray feeling, the ashtray smell. Tobacco or nicotine, whatever you want to call it, whatever you smoke, it dries up inside of the mouth. Our mouths are meant to be moist. That's why we have saliva there. It dries up, and dry teeth is prone to decay. It is more susceptible to getting decay. Also, the gums dry, there's recession, it recedes as well. And so you are more prone to gum disease. We go into the smell. That alone not a is not a happy moment for most of us. When I mean your partner is smoking all of the time, that still smell, that smell that comes out. We won't even go into the lungs. We just stay, let's stay with the mouth alone. The staining, the staining, the appearance of these teeth. And that alone, oh, that is just not what it is, but it has detrimental effects on the teeth, the health of the teeth and the gums as well. Okay, so this is what I will say about it. We will not go into the other part of it. I just want to stay there. I want us to know how seriously it can impact the teeth. The heavy staining. Sometimes the staining is there on the teeth and it's the tar is like an oil. It sticks, it adheres to the teeth that when they come for cleaning, you have a hard time having to remove it because it's been there like it adheres to the teeth like an oil. It's just not coming out. It takes a lot to have it to come out. So it shouldn't even be there in the first place.
So is
Okay?
it something that brushing does not help with?
Not really. Because if you're smoking a lot, and I know our smokers, most of them they do brush their teeth, they still get the staining.
See, but she will be back. And here she
Yeah, we're back. Yes, yes, listeners, we're back. We're back. Yes. So some of the smokers they have special toothpaste that they use that's a bit abrasive as well, because they want to remove the stains and they don't want to get the stains. It's a bit abrasive on the enamel and strips the enamel as well. So you just shouldn't smoke. Smoking should not be for anybody. That's not something that should be. That's not part of who you are. You were not meant to be a chimney. You were not meant to be that kind of person. Smoking is just not for you. It's a total destruction of what's going. What about all cancers? You know, there's so many. There's just so much. There's sores. There's just so much. That just should not be for us. It shouldn't be. Okay, it can be so detrimental to our general health, and our oral health is impacted in such a significant way. We just should not. I cannot make excuses. I cannot tell you what to do except to tell you do not.
okay. So with the cleaning, the dental cleaning,
Mhm.
how does it help? Does it help a lot? Or is it dependent on how long the person has been smoking and the state of the teeth?
It helps a lot. It helps a lot in removing the stains. It helps a lot in removing the accumulation of the buildup that is going to be there because they will have a lot of buildup. As I said, they will have gum disease, they will have advanced gum disease, periodontitis, they will have all of that happening to them. So a cleaning would eliminate that. But if you go back in the smoking, you're back to square one. So the habit must change. So we would get you looking good. Okay, get you looking good, get rid of the disease because at the stage of gingivitis especially is reversible. At the stage of periodontitis, which is the advanced gum disease, you would have had bone loss, you would have had some teeth shaking. We may be able to arrest some of that mobility a bit but not entirely. So you would have destruction on your teeth that will not be reversible. So just don't start.
Now, one of the issues that comes up a lot in terms of taking care of our health, particularly dental health, is the cost. So, a lot of people will tell you it is too expensive to go and get the basics, a cleaning, which is the basic. So, they only go to a dentist if they're in a crisis. So, for example, they have a terrible toothache, they want to get the tooth dealt with, usually extracted. That is the only time that some people would actually go to a dentist. So, in terms of what is available through the public health system, can you share with us where the dental clinics are available? Maybe the cost? Do they see children and adults? Is it walk-in? Is it appointment? So I basically want you to give us an overview of what the dental health unit can provide within the public health system.
Yeah, gladly would I do that. Let me tell you. We have oral health clinics at Leclerc Health Center, Babono Health Center, Grozilet Polyclinic. We're going down to Ancillary Health Center, Viewfort Health Center, Tenry, Miku, Soufriere. So that's where our 8 clinics are. Okay, and we have an oral health clinic run there by appointments. But we do see emergency. So if you have a toothache, we won't send you back at home until you go and make an appointment. As long as there's a dentist there, and we try to have a dentist there as much as possible, at least 4 or 3 times a day, most health centers have a dentist there. Okay, and not a day, I said this, sorry, a week, excuse me. At least 3 times a week, 3 or 4 times a week, we have a dentist at each of our clinics. Some of our clinics up in the Castries Basin, because we have a more concentration of our population is there. We have them every day. There's a dentist there, either the morning or the afternoon. So you can go there. Is to know where it is. Now, appointments are made because you need to know how to manage your work for the day. So you make appointments. Um, we do take in walk-in emergencies. I have a fat an abscess. My face is swollen. We will not turn you away. As long as there's a dentist, the dentist will see you. But you know how sometimes we wait until 12 o'clock lunchtime to come into the clinic. Sometimes, and the dentist is on their way out, the dentist still stays and does the work. But it's unfortunate that you have the toothache all night long, and morning time come, and the first thing you do not do is to run and take care of it. So we'll leave that part for another time. We'll leave that part. But I just wanted to put that there out there for the public. That's what you do. Most of you do. But the appointments are made so that we can see everybody and everybody gets their time so we can give them quality care. And also in asepsis or cleaning up the clinic, after every patient, you need time for that because you can't put you to sit on a chair that somebody was just seated on. So they have to have a measure of cleaning has to be done of the chair that you were seated on, and the instruments, the exchange of instruments to so that things can go into the sterilizer, things can be put into soak. So there's a lot going on in between patients, and sometimes the patients are not the patient or patients. They need to be seen now, and they why is that person inside for so long, and all of that kind of thing. But at our clinics, we run we do it very good. We want to safeguard our patient from cross contamination. So sometimes it takes a bit of time with one patient from seeing one patient to the next. But as I said, we make appointments. We do adults, all adults, everybody is seen. However, procedures such as fillings, we are not able to do it for the adult population. Economics cause that, not us. Okay, the adult population, the staff, we don't have enough staff to go around to be able to do that. Because if we had staff to be able to outfit every health center on the island, we wouldn't have these long waits. We wouldn't have this, that would not be. But because we have 8 clinics alone to look after the entire population of St. Lucia, it can become very difficult to see the next patient. We do fillings, cleaning, extraction for children at a cost of $5 per procedure. The adults, we do extractions, we do consultations, $25. At a private clinic, you'll pay much, much, much more than just $25. And even then, patients would come when, according to you, when the problem has become so bad on the last legs of the tooth, the last whatever life of the tooth, they come to us. And sometimes we're not able to handle that sort of situation at the clinics because of the time factor. Not because our dentists are not trained to do it, they can do it, but the time factor. We require more time to get it out. We require a little bit more for that to happen. So then we have to transfer you to the private clinic where there are X-ray machines so that they can see what they have to do, and the care is better at that point than when you come to the health center. Not that our dentists are not able to. Our dentists are the best.
I just want to go back a little bit. Did you say that you provide consultation for the adults? So is there no cleaning for the adults?
There's cleaning for adults, but we do it for the population of the hypertension, diabetic, and the pregnant mothers. Because in pregnancy, there's so much going on, all the hormonal activity. You find that more often than not that pregnant mother end up with gingivitis. That's during pregnancy. They have it. I kind of resolve itself after the pregnancy is over. So we offer that service to them.
But they should be getting a cleaning during pregnancy.
They should be getting a cleaning during pregnancy. It is best for them.
So these services are available at the eight health dental health clinics that
The
you.
eight, that is correct. The 8 health centers that we have, we do it. But remember, we have a population.
Miku and at the Viewfort Wellness Center.
Center.
I was just recapping some of the information that you shared with us earlier. As
Yes,
I have been saying that this time around, I think we're going to try to wrap up because
yes.
all those interruptions and the time is almost
Past spent already. I realize that.
yes, it's actually 11 o'clock, which I
Mm.
did not realize. So
Ah,
thank you for that, for sharing with us so much about oral health. And the World Oral Health Day, as we said in the beginning, is on the 20th of March,
that's right.
which is this Thursday.
Thursday, the Blitz.
The Blitz, so the
That's
Blitz
right.
is happening in Vigier
That's right.
Primary School, and it is in an effort to start the children getting used to healthy lifestyle
Right.
practices from very early. Lifestyle practices that can affect their dental health and their overall.
Overall health.
So, as you said earlier, you will have. Can you just give us a recap of who will be there?
Okay, so we have our nutritionist, Bureau of Health Education, UHC, mental health, the medical team there to offer services, as well as the dental team to offer comprehensive service. So all of these people are going to be there for the day. We're going to be there from 9 o'clock until the end of the day.
Okay, wonderful. So that is happening on World Oral Health
Health
Day,
Day.
the Thursday, the 20th of March. And it was a pleasure having you with us. We've learned so much. We learned a couple of very simple tips that I can remember. Rinse out,
With water.
out with water after a meal. That is much better than sucking on a mint.
That's correct.
And if we gag when we brush our tongues, which we should do daily, we make a sound.
That's right. That is right. That is right, Miss
Being a good
Minvielle.
student today.
That's right. Yes.
I
But
hope
I also want to say thank you. Thank you for affording us that opportunity, the dental services units. We heartfelt thanks to your program for allowing us that time to be able to at least speak on our World Oral Health Day and all the other issues that were raised so that we can let our public know what is going on. Thank you so much, listeners. Thank you so much, so much, so much for having us. Thank you.
thank you to you as well. And remember, a happy mouth is a
It's a happy mind. That's right.
oral health impacts how we feel about ourselves and how we interact with others. So have a wonderful day, everyone, and join us next week, Monday, for another edition of Casualty 911.
Thank you.